Hello, everyone, and welcome to tonight's session of our Holistic Health series presented by NAMI-Finger Lakes. This initiative is designed to explore the powerful connection between mental and physical health, offering expert insights and practical advice to promote overall well-being. I am Jason Hungerford, the program coordinator at NAMI-Finger Lakes, and before we begin, I'd like to take a moment to share a little about NAMI-Finger Lakes. NAMI is a national alliance on mental illness and is the largest grassroots organization focused on mental health. NAMI is made up of a national organization, state-level organizations, and nearly 700 local affiliates across the country. NAMI-Finger Lakes covers Tompkins and Cortland counties here in New York. We provide support for families, relatives, and friends of individuals diagnosed with mental health conditions. We educate the community about mental health, and we advocate for those impacted. All of our programs are free, peer-led, and guided by specially trained volunteers with lived experience. I'd like to extend my gratitude to Dr. Francesca Bellata, one of our dedicated volunteers. Dr. Bellata has been instrumental in bringing in exceptional speakers for this series, ensuring we continue to offer valuable learning opportunities to our community. So tonight's session is on navigating childhood anxiety, empowering caregivers with the SPACE program. And we are so lucky to be joined by our two esteemed presenters, Dr. Katrina Blomquist and Liz Allen. Now, Liz is the Dean of Students at Elizabeth Ann Clune Montessori School in Ithaca. In her role there, she fosters a positive and engaging learning environment, enabling students aged 3 through 14 to flourish, and she supports students and families throughout their trajectory at the school. She works closely with teachers, support specialists, and other professionals. In addition to her Montessori training, Liz has significant experience supporting young people and their families in dealing with mental health concerns. Since 2017, she has been on the NAMI-Finger Lakes Board of Directors, and she presents NAMI's signature educational programs to families, school faculty, and students in grades K through 12. Liz is also trained in the SPACE program, which you'll be hearing more about. And Liz is also the chair of the NAMI-Finger Lakes Programming Committee, and is part of our initiative to provide more resources and programs for school-aged children in our community. Welcome, Liz, and why don't you tell us who you have there with you?
I would be happy to do that. Actually, I'm going to first tell you what brought me to NAMI, my connection, and then why I'm so excited to be sitting next to this person. I was, in fact, drawn to NAMI because of the signature programs. First, there's a program called Family to Family, and I'm guessing some of you here may be familiar with it. It's the signature NAMI program. It started in the 1970s. It was really a group of families who were dealing with loved ones with mental health conditions, and they couldn't find resources. So they did their own research, they created a program, and they decided that they wanted to share their knowledge with others. From that, another program was created that is called Basics. So the idea with these programs is you're learning how to help your loved one who's dealing with a mental health condition. And Basics was adapted so it was focused when the loved one was 22 or younger. Since then, it has continued to create more programs. There are programs for parents, there are programs for faculty and staff, and now there are programs for children from all school-age children K through 12. And I went on to take my training in SPACE because it all fits in so beautifully with what NAMI's trying to do. So the fact that we are being hosted by NAMI and we are bringing SPACE to you all is just really exciting. So Katrina and I have presented NAMI before, SPACE before, and we're really happy to be doing it for you tonight. I just have the utmost respect for this person. I've shared students with her, I've brainstormed with her, and she is thoughtful, she is smart, and she's here tonight because she really cares about making a difference. And I have seen her make huge differences in people's lives. I want to read her bio because I don't want to miss a single piece. So Dr. Katrina Blomquist is a licensed clinical psychologist with advanced training in the treatment of anxiety, depression, obsessive compulsive disorders. She specialized in evidence-based therapies, including cognitive behavioral therapy and exposure response prevention, to help clients overcome obstacles and achieve their goals. She's passionate about working collaboratively. This is very true. Dr. Blomquist empowers children, adults, and adolescents to address challenges head-on. An upstate New York native, Dr. Blomquist earned her undergraduate degree from Cornell University and her PhD in clinical psychology from Duke. She completed her pre-doctoral internship at Seattle Children's Hospital and postdoctorate training at the Evidence-Based Treatment Center in Seattle with a focus on anxiety disorders. Her clinical expertise is complemented by her research developmental relationships, including friendships and jealousy dynamics during her graduate studies. Dr. Blomquist is dedicated to helping families navigate mental health concerns and has extensive experience across clinical settings, including her prior role as a psychologist at Cornell University. And she now practices at Mindwell, where she continues to make a meaningful difference in the lives of her clients. So thank you so much for sitting beside me tonight.
Well, I'm thrilled to be doing this with you, Liz. You are a gem of a community resource and has really helped to bring some important knowledge to all sorts of community members, including the EAC family, which I'm happy to be a part of too. So
yeah, I let you decide if you wanted to add that or not. So I have to tell you that we enjoy being around a table with you all and being interactive and hearing your questions as we go. So I guess what I want to do is to invite you. We are going to do a screen share and do a slideshow presentation and introduce you to space. But we also want to hear your questions. So feel free to put your questions in the chat. And if it feels like it would be best to hear your questions right away, then Jason, also my friend, will be happy to read them to me. Otherwise, we'll just ask everyone to share their screens at the end if they're comfortable doing so, and we'll have a nice chat at the end. So hope that format works for you all. At this point, I am going to share my screen. So hopefully everybody's seeing everything well. We are here to let you know about SPACE. SPACE is supportive parenting for anxious childhood emotions. It also helps those with OCD. And this program was created by, I have it right here, Eli Lebowitz. This is his book that we'll be talking about at the end. And we will give you the information for that at the end. It's a great introductory book. So what can you expect from tonight? We want to introduce you to SPACE. Our goals are to learn about child anxiety and to learn to respond more supportively to anxious children, reduce the accommodations you have been making for your child's symptoms. And I really love this quote. The biggest gift a parent can give to a child who is vulnerable to anxiety is helping them know that they can cope with it and still be okay. So, as I said, the program was created by Dr. Eli Lebowitz. And the question is, why does it work? Why does it work to help parents? And why is that so effective? And the reality is that since the beginning, parents are trained how to protect their children. You have an infant, the infant cries, they cry if they're scared, and you protect them and you work your best to make their lives okay. So it is an interpersonal connection that a parent has with the child. You know your child better than anybody, and you can almost see the fear coming on, and you're trying to prevent it. You're trying to make their lives go smoothly. And so something really natural happens. The more fearful your child is naturally, the more you are apt to create accommodations to make their lives go more smoothly. And so what we want to do is put some thought into it, what's really happening, and think about when we are putting these accommodations in, what are the results of this? The really good news is that because this is an interpersonal relationship, that we see how it grows when you are a parent with an anxious child. There's so much hope as you learn a little more about what's happening for your child and what's happening within your relationship. Little tweaks can go a long way. And so with NAMI, it's all about hope and hope that things can get better. And what we really want to let you know is that things really can get better. So keep the hope. It's super important.
And it's also nice that this program really takes into account context that the child is living with. It's here to help your kid who is anxious, but it is taking sort of what's been known a long time is that context matters, and not in a way that like parents are doing it wrong, caregivers are doing it wrong, or anything like that. But we're recognizing that there's ways in which we can empower these really important people in our children's lives to better be able to respond to them, especially in those anxious times and anxious moments, to help give them, like that quote was saying, sort of the gift that they can recognize that they can cope with anxiety and that it's okay. We're not here, and the world is not designed to eliminate all, anxious times or moments or situations. It's really a gift if we as loved ones can help our kids better manage that. So that's some of the idea behind this program. And it's kind of unique in the fact that it is really an intervention just with the caregivers or loved ones in this child's life. And I know there's some of us on here today listening that are in various roles in our kids' lives. So I'm really pleased to see that, because this is, again, I think another just like a vote of confidence for equipping people in children's lives who can help them in terms of better navigating anxiety. So it's unique in the fact that this program doesn't involve the child directly, yet we're hoping to really make an impact overall on this kid's life in terms of how anxious they are. And we can look at a lot of different measures, and it's been done in some of the research too, to see like, are we achieving this goal? Do our kids show up as less anxious, and all those kinds of ways that might look, which this next slide is speaking to a little bit. It also looks at how the family is functioning, how things are going overall. So I'm really pleased that the field itself has taken sort of a broader view of anxiety. There's still plenty of things that can be helpful if you want to work directly with a child. That may be the first thing that comes to mind if you think about helping a kid with anxiety, maybe therapy in the form of giving them coping skills or working directly with the kid. But this is another way to address these same sorts of issues. And it can actually be a huge advantage too sometimes when, hey, a kid is not really invested or wanting to be in the therapy room with a therapist, or parents really want to have some idea of how to respond, especially if they're finding that, anxiety is kind of ruling the day. It's this sort of tangled web of worry that really impacts how everybody in the family is functioning and how things are going.
Can I also say that,
Yes.
NAMI, we want you to know that you are not alone. There are so many people who are dealing with this and trying to figure out how to be the best parents that you can be. So just the fact that you're here tonight says volumes about you. So
Thank you.
Here we go.
All right, so this first slide really lists a few things that you might notice about kids who are anxious, because anxiety can look a lot of different ways. There's no one size fits all. There's a lot of different ways, from the physical sorts of sensations, stomach aches, headaches, tense, to sort of reactions and responses. A lot of times kids might have trouble with new things, transitions, changes in the routine, or just their own reactivity. There may be even some push and pull, like one of the things here says she wants friends, but she shies away from anyone trying to get close to her, or just more general sorts of things where a lot of things seem scary. And it really pulls on us as caregivers. We don't want our kids to feel like they're limited in any way, and anxiety can really limit one's world. All right, so we're going to zoom out for a moment and put this in some sort of like evolutionary and historical context. So first of all, Liz had mentioned a little bit like this connection that is there just from the moment of birth with your child, where there's children and even young mammals, evolutionarily speaking, are born in a very immature state. So they rely on their caregivers to keep them safe, to help them survive. Other species and animals have different sorts of ways this goes, but humans and mammals in general have a long period of time for which the caregivers are really important in terms of their survival. And of course, one of the biggest threats to survival is anything that is sort of threatening or dangerous. So we both, as part in that dyad, are especially attuned to one another. Children from a young age and through a long time are going to be signaling to their caregiver when they feel in danger or threatened or anxious. And this can come out in a variety of ways, crying as an infant. It can be seeking reassurance. It can be just lots of alerting and checking in with that caregiver. And that's a very natural, that's a very adaptive sort of thing. Now, when we think of anxiety disorders, how we've defined that is this chronic or inappropriate or long-standing in situations that are not needed, this activation of that fear response. So when we put that together to try to understand what we're looking at when we're seeing childhood anxiety, it's kind of the combination of these things. It's that chronic and inappropriate activation of that system, right? Like that I'm in danger, I feel unsafe sort of thing. And that's happening within the context of caregivers often. So we keep that in mind, not that this is a bad thing, this is a natural thing, but it definitely, when there's anxiety, it tends to involve the whole family. Sometimes your kids may be sort of dealing with some of this stuff on their own, and that can be heart-rending itself to see, if they're sort of like suffering in silence or whatnot. But this also gives us tremendous opportunities when it comes to how we might deal with that. And I love that caregivers are given a role here, whereas traditionally it's been very focused on the individual when it comes to mental illness and anxiety in particular.
Right.
Okay, I wanted us to take a look at some of the things that are going on in anxious brains. When we look at this, and the research pours this out too, there are a few kinds of thought patterns that typically come up with anxiety. First is the overestimation of the likelihood of negative events. So that's basically just saying people who are anxious tend to think that negative events are more apt to happen, more likely, more common. They look at a situation and they can really easily pick out sort of the negative what ifs. That comes very naturally. In addition, they view negative events as very negative. This thing is going to happen and it's going to, it's sort of the end of the world, or it's going to be very hard to deal with, or it's going to ruin everything. That's some sort of typical kinds of thinking. And unfortunately, the opposite also, positive events are less positive. So taken together, you can see that this is kind of a recipe for feeling like, the world is a dangerous place, or things are pretty bleak. Likewise, if you had this kind of thinking and you weren't anxious already, you would probably feel anxious. Along with this, there are certain ways of being, actions, behavior that are typical when one is experiencing anxiety. Because we know that the job of that whole anxiety system is to keep us safe and away from harm, one of the biggest things that you may be seeing when it comes to interactions with the world is avoidance, because it seems like a pretty easy shortcut way to just stay away from all those things, to steer clear of danger, threats, just even that feeling, which can be so uncomfortable, of anxiety. So avoidance can be seen at many, many junctures here. So this little cartoon shows, kind of what might be going on in someone's head Whereas the reality, people may be wanting to play and interact and whatever, but it seems like, oh, I couldn't possibly, sorts of things. Over time, this really might limit the world of this child or this person who's feeling that way. They feel like in order to be safe, they have to steer clear of so many things that their world might become smaller. There's another part of here that's not actually on the slide, but maybe something that a lot of you can relate to is it's not always just avoidance. There may be a lot of additional things that your child may be doing to try to manage this anxiety that involves like extra stuff. Asking a lot for reassurance. Is this okay? Or is it safe? Let's check, if there's bad things, lots of checking, I'm thinking of like kids afraid of sort of like natural disasters and weather might be doing a lot of checking of the weather or research. The age of computers here, there's no end to what can be done in terms of research and checking, which might start off seeming like a way to feel less anxious, but can definitely fuel things. And if OCD, obsessive compulsive disorder, is part of the picture, you often see a lot of this sort of like rituals or addition of things to try to deal with this anxiety, and may even provide some temporary relief, but tends to maintain this, which we'll get into a little bit more.
So this is usually when we like to pause and have a conversation, but what I'm going to ask for you is just to think for yourselves as the caregivers, how has your child's anxiety impacted your personal boundaries?
Liz
Do you
and Katrina,
feel...
we actually have a question here that I think is
Oh, sure.
a good time.
Yeah, great.
How can a caregiver decide when anxiety is normal and when it is out of control?
This is kind of where we're going right now. So you are right. You are right on the spot. And we're going to be discussing that because, anxiety is a healthy emotion and we all have anxiety and it's on a spectrum. I don't know if you want to give a little sneak preview or...
Yeah, the goal is not that, anxiety can never exist. In fact, we really want to be helping our kids know that like you can feel that, it's okay. You can move forward with life. But some of the things we might look at here, this slide talks about the impacts that you might notice as the caregiver kind of in your own world, which includes your child and your family. But it might be things like, is this fear or these rituals or whatever is happening as a part of this, is this getting in the way of your kid's life? Is it getting in the way of your life? Is it taking a lot of time? Do you feel like this is more than, your other kids, or are you doing things differently because of this anxiety than you might otherwise? So those are all some clues as to, if it sort of veers into that sort of excessive place. It may be a little bit with your kid too. Are they spending a lot of time crying or feeling fearful, those sorts of things. So there's no like strict rules or particular answer to that, except to look at sort of like the impact that these things have had.
I have to also say that with my work with NAMI, it has been helpful. I think we talk a lot about persistence and severity of incidences, but whether or not your child has a situation that would be an anxiety disorder, what I find really interesting is you're going to learn a way of communicating and a way of interacting that it can be helpful, I think, in your relationship, no matter the severity.
Yeah.
It still is, how do you create a healthy relationship in your family and a healthy relationship within yourself and your child with the feeling of anxiety? And how do we move forward and still live our lives with the fact that we are at times anxious? So no matter where you are with your child and with yourself, I think the information you're going to get tonight is helpful.
Yeah, we would love if you could come away from today's presentation with a few sort of like hands-on ideas for how to respond to your kid. It doesn't have to be that they have an anxiety disorder, because
Right.
you know, like Liz is saying, anxiety is on a spectrum. We all feel it sometimes. But it might be kind of nice to have a few things in your pocket with the context and understanding that we hope to provide too, to be able to respond, and also to know, we'll talk at the end too and open things up if people have more questions on how to do more of this or get help in any number of ways.
So I think that reading the book could be helpful for anybody. The more significant you find that your child's situation is, the more you're apt to look for more help than that, or some outside help to support you through. So if I can, there's different ways that we respond to our child when they're feeling anxious and fearful. And you're going to probably see yourself in this, because no matter what, we can go into different camps. There's this piece of us that wants to show our child we understand and to see their anxiety. And so we just want to protect them and wrap them in bubble wrap. And we can feel like, oh, our child just can't handle this. We see our child's just going to pieces, that anxiety can really hurt her. And the other side, the other extreme sometimes, is we get to the area where we just get so demanding. And it's the part of us that just wants our child to say, come on, I have confidence in you. So we think if we just get a little demanding, we might give them the gentle push that we need. And so we might find ourselves just saying, you should be able to do this. It's not scary at all. You're going to be fine. You're acting like a baby. And these things can, they come out of our mouths, but it's just us as parents trying to push them past their fear and through their fear. But it's probably not working.
And I would say too that these two goals, like to protect and to promote independence, are goals of parents. These are things that are, sort of like worthy. Sometimes the degree to which those impact like how you deal with when things are stressful and your kid is anxious, like this is where some of the extremes of that coming out may not be as helpful, right? And you may even so I don't want anyone to feel bad. First of all, I want to say, like, this is not meant to say, like, if you see yourself in any of these sorts of examples, even that you're bad or doing it wrong, anything. Like, we all sort of vacillate. And I would say, like,
we're being human.
We're being human. Listen, I do this for a living, and like I will notice, like, if my kid is anxious and it's the 10th time they've come out of their room after bedtime, like I might be doing some of that demanding sorts of stuff too, where this happens. But we want to provide some alternatives or some ideas to better balance sort of these aims, which is both to be protective and to promote independence of your kids, but not have sort of like all that you're saying and responding to be of this ilk. And you may notice that some of these things are motivating some of your reactions too.
I think also if you're co-parenting, you're going to find that you can move into both of these camps. You also might find in your family that one of you are more prone to go one way or the other. And the nice thing about going through this program, if you are co-parenting, is having an ability to collaborate with the person you're co-parenting with, and finding a shared language and a shared goal and helping each other through it. So here's our first slide where we start to move forward a little bit to where we're headed, which is we're trying to figure out how is it that we move into an area of support. How do we show understanding and also show our confidence? So the idea is the anxiety is real. The feelings that our child is having, they're real feelings. So we can show them how to accept their feelings of anxiety, but also how do we feel and show them that we're confident that they're going to be okay. And when you put together the validating and seeing what they're feeling with the confidence, that's how they can feel support. So I see that this is hard for you, and I'm 100% that you can handle it, is an example of a statement.
And when I talked about having something kind of in your pocket as a way to respond, this is what I'm talking about, right? Like support, that idea sounds really great,
Right.
positive. We actually mean something really specific when we're applying this to our kids. So our kids, let's say, having a meltdown, whatever that's looking like, asking a lot for like reassurance, right? Again, normal, we understand that where that's coming from. Here's like a way of responding that sort of hits on a lot of good things. The acceptance and the validation part is really important because, you know, it always feels good to be seen. You know, you as the parent may not be experiencing the same emotion of, you know, feeling anxious in response to that. But it always feels good. If you think about that, like, you know, in your job, or your workplace, or your life, if someone can really first accept that, or make some sort of statement that they kind of see that, or they understand that, then whatever comes next is a little bit better taken, I think,
Right.
because that is just, you know, part of the human condition. So we always start with that, you know, and it can be really brief. I see that this is hard for you. And then we are extending our confidence, even if you're not 100% sure. You know, you might be like, oh, can my kid really handle this or something? We want to extend that confidence for our kid, basically that they can get through this hard thing, or face this hard thing, or whatever it may be. So together, those two are kind of like, it's like the
secret
1-2
sauce.
punch. Yeah.
Yeah. And I think it's too that in NAMI, we always say that for that person right now, what they're feeling is so real, they can't hear anything else. So until they hear your validation, they can't hear what's next. So it's really critical. And here, the mac and cheese, you need the two to go together. You have to start with that validation before you really can show your confidence for it to really work and come together. We know you get scared when we don't come with you to get things from your room, but we're sure you'll be okay. And these statements are pretty quick, but really, as your relationship goes, you really see and identify with what they're feeling, and they're going to see and feel really heard. And you can talk about it outside of times of real anxious moments so that they know you really understand.
Mm-hmm. And you should feel free to sort of craft this how you want. Craft. You don't always want it to be too cheesy, right? But I will say I had the opportunity to like, when I was training in this, to like be the recipient of these statements. And it actually, I thought it would feel like sort of contrived or whatever. It actually felt really good. So I think there is something to this where like, you know, you still, if you're looking at these and thinking my kid would never respond to that sort of thing, you know, make it your own, but have these sort of two pieces in mind as you go forward.
So here are some good statements to have it all ring true for you.
Yeah. You know, you'll see the statements on the left sound pretty good in general, like they seem to be you know, supportive-ish statements, but on the right, we tweak it a little bit to get it even better, because we include both of those components. So, you know, not you just have the power, you have to power through, but it's hard and you have the power to get through it. I get it. It's not easy for anyone. Starts with that. I get it. It's not easy. And I know you'll be okay. Those sorts of things. Do people kind of see like what we're doing there? Does anyone have any questions about this, or responses, reactions?
We're right now talking about support, and what we want to go into next is we're going to start talking about the accommodations that we do. So it is a good point if people have any questions about support. Okay, we'll just keep right on going then. So accommodations.
Okay, so you've probably heard the term accommodation, probably in a positive context too, you know, in the school system, if there's things that are going to make it easier for your kid to do well and learn, those are all called accommodations. And actually, when we use that term sort of in this context, in this world, it really refers specifically to things that we may be doing, that are not what we normally would be doing, that are in response or in fear of, or trying to prevent, you know, a meltdown, or anxiety's ruling here, right? And we're sort of like changing things up to try to prevent that. So in general, what this is getting ahead a little bit, but what we want to do is decrease some of the accommodations to allow your child to be in the position, right? Thinking back to that first slide, we want to give your kid the ability to know that they can cope with anxiety and get through situations, and that it's going to be okay. So if they never have the opportunity to do that because we've smoothed everything out so much in their lives, first of all, it may be adding a ton of time and complications to things, but it actually is depriving the kid of that opportunity. So here are some ways that different sorts of like pieces of anxiety might come out in, just an everyday action. And we're not saying like you can never do these things or it's always bad, but we really want to like sort of switch things on its head a little bit to be able to view this in that context. Are we giving our kids the ability to sort of like face some of their fears and get the practice and learn that, if we do nothing, anxiety comes up and goes down on its own. That's just how we're built, because our bodies cannot maintain kind of that huge level of anxiety for long periods of time. Like if you see, those nature programs where the gazelles are like grazing and then they're running and then they're grazing again, like we're not alone in this. They do a much better job. There's actually a book called something like Why Zebras Don't Get Ulcers or something, because they don't have all the thought process along with it. They're either off or on. But there is something to like allowing the kids to kind of experience that and learn that. So these are some examples of accommodations, and we'll talk about how we might tweak that.
And I'm glad you brought up schools, because it's true in schools too. How do we accommodate a child's learning? How do we accommodate its child's social emotional well-being? And the big question we're trying to ask ourselves is the accommodation helping the child gradually cope? Or is it making the child more dependent? And sometimes, is it making the situation intensify? Sometimes we sit there and we start seeing the accommodations that we're doing for our child, and we kind of scratch our head and like, how did we get here? How is it that we got into the system where the bedtime routine grew from a half an hour to an hour to 3 hours long? And it happens gradually. And sometimes we just come outside of ourselves and like look from the top down and say, whoa, here I am. So, this is this slide I think is super helpful. So it starts off that your child's afraid to go get their backpack by themselves. And so you think, no big deal. I need to get out to the car. I need to get to school. I need to get moving. So you go with your child to get the backpack and you're feeling like it's a win. Because you've gotten the backpack and your child's in the car and off you go. And then suddenly the child's feeling like, well, the only way I can go to my room is if my parent comes with me. So the parent continues to accommodate the child, and the child starts to avoid more and more being alone. The need to be with the parent can intensify, and then it can grow into other areas. That anxiety can shift to other needs. So I think it's a really good thing to stop and think to yourself, what I'm doing for my child, is the end goal to support them in gradually being more independent, or is their dependency on me intensifying?
Yeah, the part here where it's like it highlights that there might be a short-term reduction in distress,
Right.
but like a longer-term maintenance, that's a real kicker, right? Like, because there's some things, and it's true, and maybe there are some days that this is how that works, right? I've been in this situation. We all probably have, where like
the clock's ticking and you're running late.
So I understand it,
Yeah.
but taken together, especially if you're noticing some of these patterns, it's just good to have in mind that some of the things that might help in the short term might be the same sort of things that are maintaining some of these fears or avoidance, and we're really about sort of reducing that. I will also say that like this example of like, the bedtime routine that can like expand and expand, even if we are doing kind of like the thing of reducing the accommodation, it doesn't mean that we have to like take everything away all the time. Like your kid would be majorly shocked if you went from a 3-hour bedtime routine to nothing, right? And everybody has their own sort of like, maybe that's a wonderful time that you spend time together. You know, we want to have sort of an appreciation for different ways families work or values that they have or cultural sort of like implications. So there's not a one size fits all here.
Right.
But it may even be that in service of getting, you know, things like from the 3-hour bedtime routine to like, you know, a 15-minute something, you still are doing some of those things, but it's in service of like getting to this other place. So sometimes we get questions like, if we're doing this thing, I think it's an accommodation, but it seems like it's actually, you know, helping us get away from this huge routine or whatever it may be. And we say that's okay.
That's
like
a win.
the things
Yeah.
that are getting you closer to, you know, what we've talked about in terms of letting your kids develop those coping and feel the rise and fall of anxiety on their own. Like that's the good stuff. And so there may be things along the way that are like a-okay, but taken alone might look like an accommodation.
We're going to get more specific, so I think it's going to get clearer as we go. So
I wanted to just give you a little bit of a sense of what the research shows here. When it comes to accommodation, and especially within a family context, this first bullet was so striking to me. 95%. This is happening. This is always happening. So, you know, like it's very easy to think like in terms of good and bad or whatever, but like, let's not do that here because we know that this is happening pretty much all the time, especially with anxious children. So it's just a reality. However, we know that more accommodation is also associated with more severe anxiety symptoms and impairments for the kid and the family along a number of different factors. Poor treatment outcome, which is just another term for like, you know, how everybody's doing. If you look at sort of individually how the kid is doing symptom wise or socially or those sorts of things, and how the family may be doing as well. And it might actually be associated with even additional problems. Like you can imagine if like this bedtime routine thing is really excessive, that it might actually interfere with the quality and length of sleep the kids are getting or you're getting. I work a lot with that too. So these are real implications that happen, which makes us think, yes, we want to target some of this accommodation.
And I love this slide. What are the kids saying?
Do accommodations help in the short term? Yes. Do they help in the long term? No. Should your parents stop accommodating? No.
Never. I think that speaks for itself.
This is kind of a little bit of a wonky slide. I encourage you to read it from the bottom up like stairs. But we wanted to give you a sense of this program, what it really entails. And if you are interested, this book that Liz showed sort of at the beginning, we can give you information. It really is like a very sort of like self-help, hands-on. We use it like if we run a group program because it has worksheets and things too in there. But it really goes through the program in detail, which starts with the introduction, but then the support, which we went over sort of briefly. And then when we take a look at accommodations, we do a couple things in sort of a very planful way. We chart accommodations. We see sort of like big picture and also specifically kind of what's going on throughout the day. And then we choose one thing. We'll talk about what makes a good target. And then we make a plan. And you'll notice in here, informing the child is on the list of things to do because we are not looking to change things drastically, just like ripping the rug out from under a kid. We would never want to do that. So there's actually a specific way that we might inform the kid kind of what's happening. But again, with this program, we're not asking the kids to change or do anything differently. What we're doing is looking at our own actions and changing things within our own control, just about what we do. And that is told to the kid also. Then we try it out. make changes as needed, get some time and practice under our belts, and then you might go kind of back to your chart and see if there's other additional things. So it's a little bit at a time, which is a nice way to go about doing some things which are really maybe changing up the status quo a little bit.
And you're really doing it together because your child knows what you're doing and why you're doing it. And you're only saying how you're changing your behavior. It's really not about the child. The book also has the forms that you need, the charts that you need in order to do this.
Okay, so here's a real life example of what an accommodation chart could look like. So in that first column on the left, we are breaking up the day into sort of like, you know, morning, during school, afternoon, evening, bedtime, nighttime, weekend, just to kind of get a sense of like routines or how things go, which might be a little bit different at different times of the day or over the weekend. If you have a child in like a two-parent household, we could do these things, you know, sort of accounting for all those things. We want to get a very nuanced sense. Now, the second column is kind of like where all the good stuff and the magic is here, because it talks about what's happening and who is involved, especially with an eye to a caregiver, because that's where the program is focused on. So you'll see the level of detail that this person went through to talk about what's happening, including like, you know, it has something in here like if I forget something upstairs, I'll get it for him. So it really encourages you and invites you to look through your day with a fine-tooth comb for things that are probably just, you know, this is part of your regular day, but when we sit it down and map it out, we'll really see where are there things that that are like maybe extra, or how do we respond to different things, or what all is in here from the moment you're up in the morning to later that might be related to some of the anxiety stuff and things that we might choose to target and change. Oh, I'll just say sorry, the last the column there is about frequency.
Right.
Because when it comes to something we're gonna change up, we tend to like to have something that happens often enough that your kid can get some good experience with when that's different and what that feels like. Okay, so if you all are curious, like how do you decide like what you're gonna target here in this program? First of all, you want to make sure it's a meaningful and significant problem. If there are things that are happening that aren't bothering the kid, taking up a lot of your time, making it harder for the family to function, you know, maybe that's not the sorts of things that you're targeting. And it's also much better just from a motivation standpoint to have something that you're really sort of like working and wanting to change because it's problematic in some way. So we want to take that into account. Like I mentioned before, having it be reoccurring and frequent enough gives it enough sort of like opportunity to have a meaningful change if you're going to be doing something differently. Here's a big one, anxiety related. We get this question a lot, like, okay, my kid is spending a lot of time brushing his teeth or showering or whatever it may be. Is that something, you know, should we be doing something about that? First of all, that's something the kid is doing, but we want to be looking at, you know, does this seem like it's related to anxiety? Are they really worried about germs or cleanliness or doing things exactly the right way or whatever it may be? Or is there like another reason that the behavior is happening, or your own behavior? You know, are you checking in a lot on the kid for one reason or another? Sometimes this is kind of like hard to suss out, but worthy of a conversation, because really, if we're looking to change sort of like a relationship with anxiety, we want to make sure it's anxiety and not something else. Now, what's the worst that could happen if it's something else? I don't know. You could work to shape around or not do something yourself that doesn't have that much impact on anxiety. So I don't know if it's the end of the world, but this is, you know, we're focused on anxiety. So we kind of want to see, is what we're targeting anxiety related? We talked about motivation a little bit. Of course, better to have something highly motivating that's really getting in the way of your family. And that it's an accommodation. It's something that you're doing or not doing. Sometimes there's a lot of avoidance and sidestepping around things, and a lot of attention and time taken to, you know, like avoid something that might set off anxiety. So that's part of it too. But we want to make sure that we're targeting the things that make the most sense.
So, is it an accommodation? And again, we're talking about the word accommodation, the context of this book and what they mean. So the shower was a really good example. The first question is it a parent behavior or is it the child's behavior? We're looking for something that you are doing. And does it seem like what you're doing, is it developmentally appropriate that you should be doing this for your child? What is your motivation? And I want to kind of go to the bottom too of considering the cultural. It could just be the culture of your family. Like one of the questions that comes up is the family bed an accommodation? That really depends. What's the motivation behind the family bed? What is your family's belief surrounding the family bed? Is it something that you want to be doing, don't want to be doing? There's some people who have some really strong opinions about it. But whether it's actually an accommodation, you have to really think about why it's happening for you. Would parents be doing this if the child was not anxious? Are they doing the same thing with other children in the family? And here is another big one for me. What happens if you don't do it? If you think if you didn't do it, or if you tried not doing that accommodation, the bigger the reaction that you see happening for the child, the bigger the evidence that there's something here that needs to be worked on.
Well said. Okay, here's an example of a plan. Remember, we start by mapping out what's going on, sort of targeting one thing, and then we're making a plan to change things, our own behavior, with hopes that it's going to have positive effects for our kids. Not that they'll like it necessarily. That's a different sort of thing. Like we all do things as caregivers that our kids may not like, but may be sort of in their best interest. So that's kind of the mindset we go into this with. Okay, so you'll notice that things are very sort of specified here, right? We want the what's and when's and how, because we want to be clear for ourselves, like what we're doing and when and how. And we also, when it comes to sharing that with the kid, we're going to pretty much tell them the exact same things. So this family's plan is about a kid who doesn't like to be alone anywhere in the house, which again, can be anxiety related, maybe not always in every circumstance, but this is the understanding we're going in with this. So the what is, we will not announce ourselves around the house. So this family had gotten very used to, and probably didn't even think too much about it anymore till we kind of did that very nuanced, mapping out and planning, that this was something that was happening a lot, that they were just sort of saying, when I'm going in the bathroom, I'm going upstairs, I'm going to be in the basement, whatever. They have a very specific start date, Monday, who's involved, how and how much. This is really interesting, and I like this too, because this highlights some of the flexibility that can happen, right? It's not supposed to be a draconian, like we're punishing you and taking away everything. This is talking about after school hours and all day on the weekends. So it may be that morning times are really chaotic and stressful.
Right.
And that's not where we're starting with this intervention, even if, over time, maybe that shifts, or maybe you go back and do more. They're starting with the after school hours and the weekend times. I love this next one. What will I do instead? Because it really, we never want to feel like we're just taking away something and then there was a reason for that, right? Like the kid was feeling maybe temporarily assured when you were saying you were somewhere in the house, and you really got used to that. And instead, you're going to think about yourself being able to move freely from room to room. Use that supportive statements if confronted, like if the kid is feeling anxious and coming to you with that, but continue going to the room I need to go to. So you can see here how we're not letting anxiety rule the roost. And we're still looking for where we can, in our role as, caregivers, and our kids are coming to us, we can use those supportive statements to just like let our kid know that we're confident in them. We see them too if it's hard. What can go wrong? Sometimes it's helpful to think ahead about the sorts of things that might happen. And if your kid responds negatively, it's not because they're like a bad kid or trying to be manipulative or anything like that. You have to think about it as like what's happening in their brain. Like they had a system that was sort of working, right, for them in terms of like trying to keep that feeling of threat and danger at bay.
Right.
And things are changing. And so they probably are not too happy about that necessarily. But we know that this is actually providing them kind of the good stuff of being able to have some practice and having anxiety not sort of like mushroom out and take over more and more of life. But you might think ahead about like, oh, well, what's going to happen if he follows me? I'll allow this without changing my behavior. This is not the end of the world, right? Like if he follows you around or yells, you want to try to remain sort of like calm and with some of these ideas in mind. But you'll notice that all of these things talk about the parent or the caregiver continuing with their behavior. So this is a very well thought out plan. We're not doing anything off the cuff. We also want to have that consistency so that their brain is not learning like I have to ramp it up to 100 to be able to get that, change or that reverting to the usual. We want to be able to kind of have thought ahead and go through with this as planned.
So the next step is an interesting one, and sometimes people question it. When I have families read this book, I say, as you read the book, you can start practicing with supportive statements right away. And you can read through this book and really prepare and get yourself ready before you do this next step. And the next step is when you bring your child in and you make them aware. And the way the book recommends doing it is with a letter. Now, some people question the letter because it seems sort of contrived and you wouldn't normally write a letter. But actually, this is exactly the reason why the book's recommending it. It's noteworthy. You're drawing a line in the sand and you're saying, this is how the way things were, and it's not working for you. It's not working for us. So this is what we're going to do. It's a calm, loving process. You choose your moment. You choose a moment when you're alone with just that one child. And the idea of this letter is that you hand it to them. It's clearly well thought out. It also is not easy to write. Every word has meaning. And so in writing it down, it gives you the opportunity to work with somebody else if you're co-parenting and to really think through the details. There's no need to rush this. Your accommodations have gotten to place over time, so it's better to take the time that you need to feel prepared for this step. So I like to read the letter because I think it all starts to make sense when you hear the voice. And pretty soon our slides will be over and we'll be able to talk about all this. We just want to show you a couple more things at the end of this, and then we'll be ready just to move into a Zoom meeting and hear what you're thinking. So take a deep breath, and I'm going to read the letter to you. Dear Adam, we love you so much and very proud of the way that you have been handling everything this past year. We also see that sometimes it's hard for you when you're not very close to us. We now realize that our behavior so far for instance, making sure you always know exactly where we are and staying close to you all the time is not helping you at all. We think it's actually making things worse because we are not giving you the chance to see that you actually can be alone sometimes. That's why we have decided that from now on, after school hours and on the weekends, we will not accompany you to different rooms of the house and will not announce where we are. We will also close the door when we go to the bathroom. We promise that we will not leave the house without telling you. There's the safety net. This might sound hard at first, but we are 100% sure that you can handle this. We are not angry at you and not trying to punish you. We simply care too much to allow your worries to hurt you in this way. We are always here to help you, but our help can't be by giving in to your fears. Love, Mom and Dad. And part of this too, when you're figuring out the target accommodation, is you want to build for success. So you're thinking about, doesn't mean it's going to be easy, but you're picking an accommodation that is small enough and during the times of the day where you're confident that you will follow through.
Now, this letter has undergone a lot of editing to get to this point. And I am curious if anyone wants to sort of add in, or maybe this will be part of a discussion later, kind of what they noticed in this letter in terms of the wording or the specific things that were the way that it was written. So if anyone has any comments, feel free to shout them out now.
Yeah, we're happy to take them now. We just have 3 more slides we want to show you, but this is really an important part.
I'll just say some of the things that often have been pointed out when we've shown this to caregivers before. You might see some of those supportive statements in there, right? You might have noticed that it starts off like on the positive, like talking about the care and concern. I was pleasantly surprised to see how positive this letter was overall. Even the things where it talks about like, we realized our behavior isn't actually helping you. So instead, we're going to do something else. I love the part where it says, so you can see that you actually can be alone sometimes. Still, the kids may not be like on board, right? Like that, back to that slide with it, what did the kids say? They're probably a little scared about the world changing, but
or they may not believe it's really going to happen until tomorrow afternoon.
Yes. Or they may like rip up this letter or whatever. And they say like, just leave it, they can have it. They can look at it later or not. But it really it shows that you are taking this seriously, that you have put thought into this, that you care, that you are really dedicated to their success.
And even if your child is not a reader, you're still going to write it as a letter. It still has impact and you can read it for them. Hi, Jason.
Well, so you asked for comments. I have a couple since no one has jumped in. I liked how you're not asking the child to do anything different. Like you're saying as the parent, this is what I'm going to be doing different. And for me, it seems like, well, there's, yes, the anxiety of this new routine might be there, but from the child's perspective, I don't have to do anything different. This isn't on me. This isn't my responsibility to take. So that was one of the things that I noticed. And I loved the what you called the safety net. We promise we won't leave the house without telling you. I think that's showing where the line is, where that boundary is, that won't ever be crossed. We promise we won't ever cross this. So you don't have to worry about truly being alone in the house if that's the underlying fear.
Exactly.
And then everything else that you said, that's staying very positive and very encouraging. I liked it.
Thanks, Jason.
Thanks, Jason. Okay, let us
wait.
just show you. Oh, did I
Oh,
hear?
I would just like to say one thing. I think it's great up until the very last thing. And then
Okay,
it goes negative. But our help can't be by giving into your fears. If I were reading that, as it depends on the age of the child, of course, but I'd be like, wait, what? This, we don't know how much the child knows about their own fears, especially if the parents have been doing this all along. They might not even know that this is a fear. I don't know. I just think it could have been said positively,
mm-hmm.
but we have to help by whatever, because I don't have an answer, but the negative there with the can't be by giving into your fears bothers me.
I think you have a valid point.
And that's where your letter may also look different. This is one
Yeah.
example, obviously, but if it feels like you would want to end in kind of that positive way, I would encourage that. Sure. I hadn't thought about it that way
Yeah.
before.
I hadn't either. I think it's a really good point. We can come back to this in the discussion if people want to look at it. This exact letter is actually in the book.
This is just a little note on, preparing for your kids' reactions, right? Because this program is all about you changing your own behaviors. And a lot of times people are kind of concerned, the reason they've been doing all these extra things or the things they've been doing the way they've been doing it is because they aren't wanting, and under any circumstances, their kids to, to feel this way or have
Right.
these big reactions. So there are a number of things that can happen as a result of changing things up, right? Even if it's just the caregivers changing up what they're doing, crying and distress. I mentioned a little bit about like sort of taking that in context too, like, listen, this is a big deal for the kids changing things around because they've sort of relied on, even if it's sort of maladaptive coping, that's been the way things have been is a coping strategy for them. So there's things, if they ignore the parents, well, what do you do there? You notice from that plan, a lot of the times the answer is just you keep going and doing the thing that you've said you're going to do. Also, consistency really matters. There may be some more escalating things too. The program goes into a little bit more of that. This also may be, if this is the level of where things are at or what you're concerned about, this may be a chance for you to work with someone else, a therapist, to get some help with that sort of thing too, because we don't want you to feel like you're on your own. This is a great program, but sometimes it can be really helpful to work it with someone else, in a group setting with a therapist or in a therapist directly, or something of that
Yeah, I was just
nature.
going to say, and Katrina's done both, where she's worked individually with a family to talk about their child. But I think there's something, and it's very much the NAMI way, that to bring families together, to share their experience, to work through the letters together, in a guided group with someone like Katrina there, just to feel like you're not alone. And sometimes you can learn so much through others' experience when you have a little more perspective and then bring that perspective back into yourself. That whole system is very much what NAMI's about.
Mm-hmm. And then I think at the next slide,
Sure.
talk about supporters.
Yes.
Yeah, they have this nice thing that goes along very nicely with sort of the aims of NAMI as well, is to bring other people. If you're a caregiver looking to implement this in your family with your kids, it really encourages you to lean on others and get support,
right,
in ways that can help make your implementation easier, or also like support the kids. So one of my favorite examples of this is there was a family I worked with who the kid like just loved this older cousin they had, looked up to him, thought the world of him. And what the parents did was ask that older cousin to just point out a time or two where they saw the kid like doing something hard, that was along the lines of like facing the fears and working on their anxiety. And the cousin said like one comment, and you could just see that it made more of an impact than like any supportive statement or anything that the parents could have said. It just came like that kid's face lit up and nothing more was said, but there really was like just like such a nice reinforcer for that. So it could also be like, you know, you go out to coffee with a friend, you know, especially if there's something in your program where you're
Right.
you know, you're dropping the kid off or something, and there could be a lot of like holding on,
Or you
like
go to a NAMI support group.
any of these sorts of
Right.
things. Don't go through this alone, and rely on build your community around that too. That's, I mean, I think that's so important for so many things,
Absolutely.
including this program.
There you go. So where do we go from here? This is our last slide we want to show you. So if you go on to spacetreatment.net, you will have more information about the SPACE program. You'll also see providers in the area who have taken this training, so that's super helpful. We both have. But Katrina is a therapist and able to meet with you. So through someone like Katrina, you could look for, as we said, therapy, individual therapy for your child if that becomes recommended, or joining one of these groups. Also highly recommend the book, whether you're doing it, whether you decide you need a therapist or not. It's a quick read, it's an easy read. And it's actually, if you're somebody who drives a lot, there's an audio version, and Dr. Lebowitz is actually the one who reads it. So that's a good way to do it.
The website is surprisingly like old school, so don't be alarmed if it seems like a little clunky, but it does have a lot of those resources. If you are interested in doing more in the therapy sort of direction, one of the common things that helps everybody sort of come in community and support is to do a group. It's usually like, you know, somewhere between 6 and 8 families. It can be even parents who are not together, who may be interested, or just one parent. I'm running one starting at the end of February. It's an 8-week virtual session. We just nailed down some of the dates and times, so it's going to be Thursdays from noon to 1. Starting the end of February, after February break for all the kiddos. And that's happening through Mindwell where I work. So if anyone's interested, I can give you more information, can talk further to you if it sounds like something that might be a good fit. So just wanted to put that out there, because sometimes it can be hard to access some of those resources or groups or things going on. So we're doing one soon.
And I'm going to ask Jason as our program manager. We on NAMI Finger Lakes website, we have a great resource, and I'm going to ask that we will put space treatment as a resource there and as a follow-up to the program that I'm so appreciative that they hosted this evening. And with that, Jason, if you would end my screen share for me.
Here we go.
Is it good?
Yeah, so I did have a couple of questions from in the chat, and for those of you that are still with us, if you'd like to participate in this Q&A, you can unmute yourself at any time you have a question. You can even turn your camera on if you'd like. It's a lot easier to talk to somebody if we can see your face. So you did mention the Mindwell parent group. If you could send that info to me, and then I'll distribute it to everyone who joined tonight as well. Liz, we had a question. Could we get the slides to also distribute to folks?
We'll give it to you, and then you can share it.
Yeah. There was a question about, or a statement about that this might be good for teachers and those in the educational system. So what is your knowledge on are teachers being trained in this, and is there a push for this at all in our community or elsewhere?
They certainly can be, and so there are several school counselors who are on this, and we invited school counselors from Tompkins County, just so you know, so they could be made aware and share it with their teachers. And I think a lot of what the schools can do is also refer you to where you can get access to this. I definitely am doing my best to spread the word. And if the person who asked that question is a parent, or for that matter, if you are a social worker, I strongly recommend you to show this book and share it with teachers. Hopefully you're making a partnership with your teachers. They get to see who your child is in community with peers. They get to see a different perspective, and the more you can share your experiences with that child, the more you can support them and help them.
And you can probably see how the things like supportive statements could be widely used in like
Absolutely.
all sorts of places that adults are interacting with kids in the classroom and at home. I know that, like, not formally, but different elements of this kind of model are used like in the school drop-off, sort of like procedures like at EAC and stuff like that. So I think there's a lot of ways that school personnel could really benefit from this, or see ways that they could use these kinds of ideas in their own classrooms.
I definitely bring this information to our staff, so people at our school do hear about it, and I hope the people from different school districts who are here will share it with their staffs as well.
Yeah, so I was just going to quickly add that I think it's not just for kids. I mean, I think I was taking notes on things and I think it'd be great to the affirming their feeling, but then expressing confidence, and I think that's a great tool for youth and adults as well.
Well, I want to say that you also host one of our support groups, and so Jason is a great support group leader, and so and I find this to be true, and in all the work that I've done, all the trainings I've done, that in day-to-day conversation, it's always helpful to have new communication techniques and new listening techniques.
Yeah, and sorry, Marie, I didn't mean to cut you off. Go ahead.
No, I was just going to say I have two perspectives here. One is as a school nurse,
Mm-hmm.
and it's nice to hear you talk about it. I have, of course, you can imagine that many of the kids who come to me as frequently are kids who are coming because of anxiety, and there are some kids with pretty significant diagnosis of OCD, and they come to me. There's one person I'm thinking about in particular who comes, and it's always the same. I'm shaky. I don't feel quite right. Can you take my blood pressure? And I've actually been trying to talk to, before I started reading about the space, I was like, oh, I think I've been implementing this.
Mm-hmm.
She knows that I know that she has anxiety, and I say, I think that this is your anxiety, and let's see how we can but I feel like I want to go even deeper because it doesn't stop it. She can hear what I'm saying. She can intellectually understand it's her anxiety, but she perseverates, as OCD will make you do, but why do I feel this way? Why do I feel this way? Why, please take my blood pressure. And I'm thinking, would you suggest I get in touch with her mother and see if I can say, actually, I'm not going to take your blood pressure. Like I want to start figuring out how to not participate that feels accommodating to me.
So
what
what we do here, I mean, I work really closely with our school nurse when we have a child who's having difficulty, because we know that sometimes it'll come through my office and sometimes it'll come through the nurse's office. And if we need to, we create team meetings. Sometimes those students also are seeing private therapists. And so we'll ask the parents that, we're doing all we can within our school environment, and we need more support to have your child have the best experience possible. If you're willing to sign a waiver, we would like to bring in new strategies. And when you work together, and you start using the same language, and you triangulate home, school, therapists, whoever, to work in the same direction with common goals, we find that we can make really big changes. And honestly, that's how we developed. Not only do I know her as a parent, but this is how we developed our relationship, was being able to put together in that way. It's incredibly powerful. So a little bit is building the trust with the parents and understanding the why, that sometimes parents are really afraid of their child being labeled. And so explaining the why and what is the benefit of triangulating this information, and that you'll hold this information confidential. So if I were you as the nurse, I would also probably try to connect with the school counselor if it's appropriate, or maybe one other person within the school.
Yeah, I mean, she's this child. I mean, I mean, we do that. We have like support staff meetings, but I was just like, I have to take the next step, because I feel like I'm sort of being complicit in perpetuating the situation by not just saying like, let's think of other ways that I can be supportive of you that will help disengage the anxiety.
And I'm totally with you. And from the therapist perspective, this would be like a very solid plan that we might have with the nurse. Something like, you know, language that you can use, you know, certainly sounds like this is anxiety. This is the way anxiety can, you know, some of that sort of like background understanding. Even something like, I don't want to feed your anxiety. You know, like this sort of thing where like the excessive like monitoring and blood pressures might be feeding the anxiety. So maybe a plan would include, you know, taking a blood pressure one time and not more, or something like that, you know, or I don't know exactly how it could look, but I think you're on totally the right track. I think the challenge will be to like have, you know, your ideas as part of a plan that, you know, the team is kind of on board with parents, or the therapist is involved. I think that would be brilliant. And I love hearing that from, you know, just like more members of this person's life, and you're really interfacing with some of the ways the anxiety is coming out. So,
and there may be some strategy that the therapist is working with. So maybe rather than the blood pressure, you're going to do one of those strategies and say, I hear that you have found that this is helpful. Let's give it a try. And then with them, you do another strategy.
Right, like a breathing, deep breathing.
A breathing. That's what I was thinking, or that you see. We all know them.
Yeah. Can I just
I guess it's 5 that you see.
Say that again?
5 that you see.
Yeah, right. Exactly. The other thing is, I wanted to just, I'm coming from a perspective of parent, Liz, you know, like my son, and still like lots and lots of anxiety and depression. But I was thinking about, Jason, what you had said about like these strategies. Like when I read about the space program, I was like, oh my God, this is like, I've been trying to implement this on my own. I was like, oh, there's like codified like research on this to like disengage, stop accommodating, like the accommodation. I love the concept of like, no shame attached to the natural inclination as a parent to want to protect your child, then it just sort of snowballs to try to keep them out of distress. And the whole Dr. Lebowitz, is that his name?
Yeah.
The whole failure to launch concept of like that this can be used with older children who are still like very dependent on their caregivers to get reassurance. And so I'm like so excited about this program. So thank you.
And as they're older, right, a lot of it is about self-awareness and self-advocacy.
Right,
and
exactly.
Your comment even got me thinking like, this could just be in any relationship with someone who's anxious, or, you know, like having a way to respond to that person that is supportive in that way, but doesn't, you know, change the whole dynamic. Like, so awesome.
Well, I love it because Jason's support group is a partner support group.
Look at that.
How did you intuit that?
And also even self-talk, like, like I can do this. I'm anxious, but I can do this. So thanks for introducing this.
And, you know, I think this partners well with what we do in NAMI is, you know, we're supporting those around the person that is dealing with the mental health condition. And there's lots of different tools and strategies that we can use. And and some may work one day and not work another day. And so we're always looking for additional tools. And so I'm thankful that I was able to listen in on this program and grab some nuggets here to bring back to my partner and spouse group, that these are some additional tools that we can use. And so I think the application, while maybe developed for children, I think it can be very wide ranging.
For sure.
So we have just a few minutes left. Is there anyone that has any other questions or comments that they'd like to share before we wrap up?
Hi guys, I'm Francesca. Hi Jason. I just want to say I really value that you guys can take the time. You guys, they're volunteering their time to do this. I think the most important takeaway always from the speaker series is resources, resources, resources. So even after this meeting, where can they go? And one more question about the Mindwell group, Katrina. Is it open to all caretakers, even maybe grandparents or someone else in the child's life?
Yes.
Yeah, I kept thinking, he does use the word parent, but we really do like to use the word caregiver.
So where can one go for additional resources other than the Mindwell group? I mean, of course, I'm going to promote NAMI. NAMI has a family support group, meets twice a month. You can join that and share with each other, the strategies and to kind of vent frustration and share in the downtime, and also be encouraged to keep going. And it's really a wonderful group of people, and all of our support groups, like I said earlier, all our support groups are led by specially trained volunteers with lived experience. That means that they too have a loved one in their life with a mental illness, and so it's a very bonding experience. Any additional resources other than those two that you guys might
I will
suggest?
say that we will give you the slideshow, and we will give you the book, and we will give you the link to be able to sign up to the Mindwell group. And they do it periodically. So if that time doesn't work for you, perhaps if you emailed, we could maybe entice Katrina to do another time, a little later in the year. And so you'll have all the resources. You'll have we're happy to share, may I say, our contact information.
Always.
I don't want to over volunteer
Oh,
my
no.
friend here. And happy to brainstorm with you for sure. And as my role in the school, the more I can work with other schools and show them how I've used a lot of the NAMI programs for K-12. I would love to hear that everybody's using them. I think you can make a huge difference. What's exciting about this program or this book is I'm a big believer in early intervention. So a lot of what NAMI does is it deals with people that have really significant, severe mental illness. But if we could start early and have dialogue and have trust and take away stigma, I really believe that early intervention can change the trajectory of people's lives. And the more significant somebody's struggle is, the more they need their loved ones, that's us, to have the language, to be able to advocate for them, because sometimes they're not in a position where they can do it for themselves. So early intervention is huge.
Yeah, and so I will just kind of shamelessly promote some of our programs, or some of our educational programs that we have geared towards young people. Our youngest set is Meet Little Monster. It is a fun coloring and activity book that teaches kids how to notice their feelings and how to express them. But more than that, it's actually a great piece for parents to have a conversation with their children about feelings and emotions and how to express them appropriately. And then we have a newer program that Liz and I are trained in. It's called Youth Mental Chat. It is geared towards grades 3 through 5. And we're launching it this year. And again, that's just sort of bringing some awareness of mental health issues and really explaining to children that everyone has mental health, and again, recognizing what those things are. Kids may hear these words like anxiety and they might think that they have anxiety, and sort of dispelling that, well, everyone gets anxious before a test, and anxiety is only an issue when it stays and it's, kind of becomes problematic for you. It's just it's a great educational piece. I'm not even doing it justice by trying to summarize it. And then we have
we're going to do it together. So, a little sneak preview. We're going to do it here at this school. So we're super excited to do it together.
Yeah, it comes with a slideshow and a book. And it's just really just an opening discussion. And it's great. It's just great for that age group. And then we have Ending the Silence, that is geared towards for older kids, mainly high school. And again, that sort of goes a little bit deeper and talks about how to recognize when your friend might be dealing with, depression or anxiety, and how to help them. And so we have lots of these programs, basically.
And I actually love doing that one for 7th and 8th graders, so that they have the toolkit necessary to enter a high school. I want them to enter high school feeling really prepared. And I also think the nice thing about doing it with 7th and 8th graders is they're still willing to communicate pretty openly with their families. And the idea that you don't want to keep something that a friend has told you a secret, like it's okay to reach out for help. And when is that actually being the better friend? So there's a lot to understand and to unwrap there.
So for those of you that are in the school system, I will be emailing you with all the information that we compile tonight. But just letting you know that this is an initiative of ours that we are focusing on this year. So we would love to have you partner with us on that.
Yeah, and I'm super eager to chat with anybody and share my experience of doing it in a school setting. Just going back to Meet Little Monster, it's a really great way, if you're a social worker, something that you can do to get out of your office and reach the students and have your own relationship. Or, Maria, school nurse could do it too.
All right. Well, thank you very much, Katrina, Liz. Thank you all for joining us. This was really, really informative, and I think it's going to help a lot of people. So thank you so much. And I hope everyone has a good night.
You too.
Good night.